Hey there, future CNAs. Ready to level up your skills and confidence? This video is just the beginning. We have even more CNA practice tests and lessons waiting for you, and the best part, it's completely free. So check it out. Now let's get started.
Question 1. How many fingers should you be able to slide under wrist restraints? A. 1. B. 0. C. 2. D. 4. The correct answer is C. 2. It is important that you can fit 2 fingers under the wrist restraint. This ensures that the wrist restraints are not too tight or too loose. The restraints should be assessed a minimum of every 2 hours. The resident should be discontinued as soon as possible. Question 2. A resident that usually loves going to bingo game nights is sitting in her room crying. She states that she does not want to go to bingo tonight. What is your response to her? A. Okay, you don't have to go. Maybe another night. B. Why don't you want to go? All of your friends are there. C. There are going to be lots of fun prizes. You should go. D. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? The correct answer is D. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? Acknowledging the resident's feelings and asking her if she'd like to talk about it is appropriate. All of the other options blow off the resident's feelings and can make her feel like her feelings do not matter. Question 3. In relation to the recent outbreaks of COVID that have affected long-term care facilities, the Certified Nursing Assistant, CNA, is aware that what problem has acutely risen with the residents? A. Feelings of isolation from family and friends. B. Feelings of worry related to death by COVID. C. Feeling scared because the staff is in isolation attire. D. Feelings of anger about not understanding COVID precautions. The correct answer is A. Feelings of isolation from family and friends. The primary effect COVID has had on elders in long-term care is isolation from family and friends. Although residents may worry about death from COVID or feel angry about the use of COVID precautions, that is still not as prevalent as isolation. They also have to adjust to seeing the staff dressed out in isolation gear. Question 4. You have been busy during your 12-hour shift and haven't been able to empty your patient's Foley bag. You go in right before your shift is over to document output. What output amount would bring caution? A. 1,000 milliliters. B. 600 milliliters. C. 2,100 milliliters. D. 350 milliliters. The correct answer is D. 350 milliliters. You would be concerned about 350 milliliters in the Foley catheter bag because the patient could be leaning toward acute kidney failure. A patient should have a minimum of 30 milliliters per hour of urine output. The charge nurse should be notified immediately of this patient's urine output. Question 5. Which one of the following would require contact precautions? A. TB. B. COVID-19. C. Pneumonia. D. MRSA. The correct answer is D. MRSA. MRSA would require contact precautions only. TB would require airborne precautions. COVID-19 would require contact, airborne, and droplet precautions. Pneumonia would require droplet precautions. Question 6. You have an 85-year-old patient that you suspect is in pain. You know that indications of pain can include which of the following except A. Insomnia. B. Seclusion. C. Participating in social events. D. Agitation. The correct answer is C. Participating in social events. It is not uncommon to see geriatric patients suffering from insomnia, seclusion, and agitation when in pain. They may stop participating in social events and activities that they once loved. Poor psychological health is a strong indication of pain in the elderly. Question 7. Which of the following happens when a patient has a stroke? A. The patient urinates themselves. B. The patient may foam at the mouth. C. The patient may roll their eyes back. D. The patient may have drooping of one side of the face. The correct answer is D. The patient may have drooping of one side of the face. It is common for the patient to have drooping of one side of the face while having a stroke. This is often called asymmetrical drooping. With asymmetrical drooping, if you ask the patient to smile and they smile, one side of the lips will not move. It is also common for one-sided eye drooping to occur. Question 8. The focus of providing ADLS in your patients include the following except A. The comfort of the CNA. B. Comfort. C. Safety. D. Dignity. Respect. The correct answer is A. The comfort of the CNA. Comfort, safety, and dignity, respect should be your top priority when caring for patients as a CNA. It can be a challenge for a patient when they can no longer provide care to themselves, especially when it comes to the more sensitive care like bathing. Ensuring dignity is a priority as a CNA. Comfort can range from a lot of things like ensuring the water is warm and not too hot or cold to combing a patient's hair the way she likes it. Question 9. You come into work and you are assigned to a different hall than usual. You have a resident that you have never met before. What is the proper way to introduce yourself at the beginning of your shift, and what do you call the resident? A. Introduce your name to the resident. Her name is on the care plan, so no need to ask her what her name is. B. Introduce yourself to the resident and ask her what name she would like to be called. C. Walk in and call the patient by the name on her care plan. Your name is on your badge so she can read it. No need to tell her what your name is. D. The charge nurse already told the resident your name and told you the name of the resident, so no need for a proper introduction. The correct answer is B. Introduce yourself to the resident and ask her what name she would like to be called. It is important to be courteous to the resident. Even if her name is on the care plan, the resident may prefer to be called another name. It is always imperative to introduce yourself as well. This helps build rapport with your residents. Question 10. You have a patient who is sweating, has a low heart rate, fruity-smelling breath, and can barely speak to you. What is the next step you would take? A. Obtain a POC glucose EV. B. Bring the patient 24 ounces of orange juice. C. Turn the air on in the patient's room. D. Ask the patient to brush their teeth. The correct answer is A. Obtain a POC glucose. Sweating, low heart rate, fruity breath, and confidence changes can indicate glucose changes. The first step is to obtain a POC glucose so that you can report the glucose reading to the nurse in charge. Question 11. Your patient is on strict IO status. What is important to measure for this patient? A. All solid and liquid food that the patient consumes. B. Don't allow the patient food or water. C. Measure the patient's void first thing in the morning and last thing at night. D. Measure all liquids that the patient consumes and measure all urine output. The correct answer is D. Measure all liquids that the patient consumes and measure all urine output. IO means to measure all liquid intake and output. Liquids should be measured in cubic centimeters or milliliters only. If a patient is drinking 4-ounce cups of water, multiply 4 ounces of water by 30, and you have 120 cubic centimeters or 120 milliliters of water. 1 ounce equals 30 milliliters. A urine hat or some type of urometer should be used to measure urine output properly. Question 12. The CNA is aware of common mental health issues that are experienced by elderly adults. These may be brought on by all the following situations, except A. The death of a spouse. B. Loss of financial independence. C. Increasing health issues. D. Faith-based group activities. The correct answer is D. Faith-based group activities. The death of a spouse, loss of financial independence, increased health concerns, and the changing of their role within their family are all issues that many older adults face in long-term care. If the patient has a healthy relationship with family and friends, having quality visiting time with family should fulfill the patient. Question 13. Which of the following is an example of subjective information? A. The patient's pain level is 7 out of 10. B. The patient's temperature is 101.2. C. The patient had eggs for breakfast. D. The patient's blood pressure is 120/80. The correct answer is A. The patient's pain level is 7 out of 10. The patient's pain level is 7 out of 10 is subjective data. Subjective means something one cannot see. The patient can tell you that they are in pain, but the pain cannot be seen. Therefore, pain is subjective. Question 14. You notice your resident is grimacing when you walk into his room. He is reluctant to say that he is in pain. What should you, as the CNA, do? A. Explain to the resident that if he is in pain, it's okay to talk about it so that you can report it to the nurse. B. Nothing. The patient said he is fine, so he must not be in pain. C. Tell the resident that he doesn't have to be tough. If he is in pain, he should tell you. D. Say nothing to the resident, but report the pain to the charge nurse. The correct answer is A. Explain to the resident that if he is in pain, it's okay to talk about it so that you can report it to the nurse. Acknowledging the patient's feelings is important. Some cultures do not allow one to express their pain, so the patient could be in a lot of pain, but because of his culture, is unable to speak about it. Question 15. You have a patient in restraints. You know the proper place to always tie restraints to is where? A. The bed frame. B. The upper bed rail. C. The lower bed rail. D. The head of the bed. The correct answer is A. The bed frame. The safest place to tie restraints is to the bed rail. All other parts of the bed are movable and can cause the restraints to become too loose or too tight. This can cause harm to the patient or healthcare employee. Question 16. Upon finding some unlabeled pills in a nightstand, the CNA should A. Provide water and insist the resident take them as soon as possible. B. Discard them. C. Leave them alone to respect patient confidentiality. D. Notify the nurse immediately. The correct answer is D. Notify the nurse immediately. Residents have the right to refuse medications and treatment. It is not within the CNA's the scope of practice to administer medications. All medications should be labeled. It is the responsibility of the medical staff to determine if a resident's care plan includes which medications. Question 17. An immobile client requires transfer from a chair to their bed. Which of the following should the CNA utilize to transfer this client? A. Gait belt. B. Physical assist of 1. C. Contact guard assist. D. Mechanical lift. The correct answer is D. Mechanical lift. Clients who are immobile require the assistance of a mechanical lift to promote safety. Question 18. If a resident reports that a family member is stealing money, the CNA should A. Reassure the resident that their money is safe. B. Call the police. C. Notify the supervisor or case manager. D. Advise a different family member about the resident's concerns. The correct answer is C. Notify the supervisor or case manager. Residents have the right of management and security of personal funds and the right of freedom from abuse, neglect, or mistreatment. Financial abuse is reportable. Confusion and memory loss are common in the elderly. Question 19. You are in a rush to get your morning round of patient care done, but your patient is in the middle of a story that he wants to tell you. How should you address this with the patient? A. Slowly start walking backward toward the door. Maybe the patient will get the hint. B. Keep doing your duties for this patient. They talk like this all of the time. C. Kindly explain to the patient that you have multiple other patients to see and that you would love to finish this story after your first morning rounds. Assure the patient you will come back when you are free. D. Sit and talk with the patient. Your other patients can wait. This patient really wants to tell you this story, and it's rude to interrupt. The correct answer is C. Kindly explain to the patient that you have multiple other patients to see and that you would love to finish this story after your first morning rounds. Assure the patient you will come back when you are free. C is appropriate because you do have multiple other patients and must ensure that they are taken care of. Making the patient feel that you care about their story is important. Walking toward the door makes a patient feel as though you are in a rush, and what they are saying isn't important. Question 20. If a CNA sees something a resident owns in the backpack of another staff member, the CNA should A. Assume it was a gift to that person from the resident and say nothing. B. Call the police. C. Take it out of the backpack and return it to the resident. D. Ask the other staff member and report it if it doesn't sound right. The correct answer is D. Ask the other staff member and report it if it doesn't sound right. Residents have the right to keep and use belongings. Assumptions should not be made. The situation should be investigated if it appears a resident's rights are not being honored.
Question 21. If another staff member hides the call bell from a resident who frequently uses it even though nothing is needed, the CNA should A. Be grateful because there is no time to answer the call bell so often. B. Give the resident a fake call bell. C. Tell the resident someone will visit every hour to see if she really needs something. D. Return the call bell within reach of the resident and report the staff member for neglect. The correct answer is D. Return the call bell within reach of the resident and report the staff member for neglect. Residents have the right of freedom from abuse, neglect, or mistreatment. The resident has the right to be safe in their environment. The ability to call for assistance is required for resident safety. Question 22. The Certified Nursing Assistant, CNA, is aware that the long-term care resident may resort to manipulation of the staff. The CNA recognizes manipulation as what behavior? A. Constant complaints of pain or discomfort each time a new staff member is on their unit. B. Lying to the other residents on their unit. C. Refusal to take medications. D. Sitting alone for all meals. The correct answer is A. Constant complaints of pain or discomfort each time a new staff member is on their unit. The resident may complain of pain or discomfort to a new staff member in order to receive medications. This is a form of manipulating an unsuspecting nurse. Lying, refusing medication, or sitting alone are not forms of manipulation by the resident. Question 23. You are using a pulse oximeter on a patient. You know a pulse oximeter is used to measure what? A. The amount of O2 in the patient's blood. B. The amount of CO2 in the patient's blood. C. The amount of CO2 in the patient's lungs. D. The amount of O2 in the patient's heart. The correct answer is A. The amount of O2 in the patient's blood. Pulse oximetry is a non-invasive way of measuring peripheral oxygen in the patient's blood. This reading is less accurate than an arterial oxygen reading. However, the pulse oximetry reading is very close to the arterial reading. Question 24. You have a patient who is incontinent of bowel and bladder. You know this patient is at increased risk for what? A. Pressure wounds. B. Dehydration. C. Depression.
D. Anxiety. The correct answer is A. Pressure wounds. Urine and feces are acidic and can break down healthy skin. Further, urine causes the skin to be wet for a prolonged period of time, causing a major risk in skin breakdown. If the skin is wet, friction from the patient's clothes or bed linens can easily cause a break in the skin. This also sets the patient up for infection if there is a break in the skin. Question 25. If a resident is found crying in a common area, the CNA should A. Guide the resident to a private area and ask what is wrong. B. Give the resident privacy and leave them alone. C. Tell them that others are being disturbed and ask the resident to leave the common area. D. Call the resident's family. The correct answer is A. Guide the resident to a private area and ask what is wrong. Residents have the right of confidentiality of personal and clinical information. The care team should provide emotional support in addition to physical care. Compassion includes listening. Question 26. Which one of the following medical abbreviations is inappropriate for use? A. TID for 3 times a day. B. BID for 2 times a day. C. QD for daily. D. NPO for nothing by mouth. The correct answer is C. QD for daily. QD or QID should never be used for abbreviations in the medical field. It can easily be confused with QOD or other abbreviations. JCAHO states that it is only acceptable to write out daily and every other day. No abbreviations can be used for these terms. Question 27. What is the proper measurement for measuring bodily fluids? A. Ounces. B. Liters. C. Milliliters. D. Fluid ounces. The correct answer is C. Milliliters. The standard for measuring all bodily fluids in nursing is using milliliters. If a patient is drinking fluids in ounces and you need to chart input, convert ounces to milliliters by multiplying ounces times 30. 1 ounce equals 30 milliliters. Question 28. You are taking care of a resident who began hospice care last week. Today she is unable to speak and you are unsure if she can hear. The patient's daughter is at the bedside. How would you enter her room for private care? A. Come in and start performing your care. The patient is near death and can't hear. There's no need to introduce yourself if she cannot hear you. B. The daughter is in the room, so you tell the daughter what you're going to do for her mom. C. Let the daughter provide the care. After all, the family members know the residents the best. D. Knock, introduce yourself, and explain to others, the daughter and the patient, why you are there. Proceed with care to be given. The correct answer is D. Knock, introduce yourself, and explain to others, the daughter and the patient, why you are there. Proceed with care to be given. Residents should always be treated with respect, no matter what stage of life they are in. It is important to knock, introduce yourself, explain why you're there, and acknowledge everyone in the room. Even if a patient is unable to hear, see, or speak, they should be treated like any other patient. Studies show that hearing is one of the last senses that humans lose during the final stages of life. Question 29. You are putting linens on a patient's bed. You know that not having wrinkles in the sheets is important because A. It can cause a decubitus ulcer. B. The patient may get upset. C. The patient's foot may get caught in it. D. It may cause a fall. The correct answer is A. It can cause a decubitus ulcer. A decubitus ulcer is otherwise known as a bed sore. Any wrinkles in the sheets can cause breakdown in the skin, resulting in a decubitus ulcer. Patients who are in the bed for a prolonged period of time are at high risk for decubitus ulcers. Question 30. The CNA measures the blood pressure of a client to be 200/180. The client is not in distress. What should the CNA do next? A. Ensure the blood pressure cuff used is the correct size and repeat the measurement. B. Record the measurement in the record and continue with the assignment. C. Immediately notify the nursing supervisor. D. Measure the client's temperature and pulse to complete the vitals set. The correct answer is D. Measure the client's temperature and pulse to complete the vitals set. Although B is right, introducing yourself is more appropriate because the resident cannot see you. Also, C is only okay if the patient gives you permission to personally touch their hands. Question 31. You have a patient that only seems to become confused and agitated after dark. What is the patient most likely experiencing? A. Dementia. B. Alzheimer's. C. Sundowner syndrome. D. Psychosis. The correct answer is C. Sundowner syndrome. It is common for the older adult to experience confusion after dark. The clinical term for this is Sundowner syndrome. It literally means confusion after the sun goes down. Question 32. Which of these are important for the care of a diabetic patient? A. Giving the patient a heating pad for his feet when they're cold. B. Soaking his dry, calloused feet in a warm tub daily. C. Keep his feet dry and warm with dry, clean socks. D. Ensuring his toenails are always clipped short for cleanliness. The correct answer is C. Keep his feet dry and warm with dry, clean socks. It is important to always keep a diabetic's feet clean and dry. Any extra soaking of the skin that may allow bacteria into broken skin can lead to infection. It is common for a diabetic patient to have neuropathy in their feet, causing them to not be able to feel their feet. A daily foot inspection of the feet is very important for the diabetic patient. It is imperative to allow a podiatrist to clip the toenails of a diabetic patient to decrease the risk of cuts and infection. Question 33. You have a patient that has incontinence who wears briefs. What is necessary for patients with stress incontinence? A. A Foley catheter to keep the skin dry. B. Frequent toileting breaks throughout the day. C. Less fluids to keep them from urinating often. D. Diuretics to help keep their bladder empty. The correct answer is B. Frequent toileting breaks throughout the day. It is important to assist patients with incontinence to the restroom throughout the day so that their bladder isn't getting too full. A Foley catheter significantly increases the risk of a urinary tract infection. It is unsafe to withhold fluids from a patient due to incontinence. Diuretics can lead to dehydration and electrolyte imbalances. Question 34. A resident states they wish their life would end. The CNA knows. A. Elderly people say things like that and don't mean it. B. It is impossible to harm oneself in a long-term care facility. C. The resident needs help even if they don't mean it. D. Residents have the right to harm themselves if they want. The correct answer is C. The resident needs help even if they don't mean it. All threats of self-harm are reportable and must be investigated by qualified practitioners. It is not within the CNA's scope of practice to determine how serious a resident's comment is. Patient safety is the responsibility of all staff. Question 35. You have a patient that had a fall. You must write an incident report. What is the reason for an incident report? A. To show patterns and trends and to prevent further incidents. B. To see who is at fault for the incident. C. To show the doctor how weak the patient is. D. To keep a record for the family members. The correct answer is A. To show patterns and trends and to prevent further incidents. An incident report is written when any unusual event happens in the healthcare setting, whether it be for patients or staff. Committees can review incident reports and see if there are patterns or trends leading to a specific incident. This helps committees write policies that can help prevent further incidents from happening. Question 36. Which of the following demonstrates a CNA intervention to foster client independence? A. Encouraging the client to fully participate in bathing activities as they are able. B. Cutting up a food for the client so they don't have to do it. C. Scheduling meal times for the client. D. Selecting clothing you feel looks best on the client. The correct answer is A. Encouraging the client to fully participate in bathing activities as they are able. Fostering independence includes encouraging and allowing the client to participate in as much of their care as they are able. Assistance should be offered and provided for tasks which the client is not able to complete by themselves. Question 37. You have a confused patient who is always hitting her call light, but never needs anything. You know that she is lonely and just wants someone to talk to. You are busy and decide to not answer her call light because she probably only wants to talk anyway. You know this can be seen as what? A. False imprisonment. B. Breaking HIPAA. C. Neglect, abuse. D. Emotional damage. The correct answer is C. Neglect, abuse. Abuse and neglect occur when a client does not receive necessary physical or mental care. This includes failure to respond to a call light. Call lights should always be answered in a timely manner. Question 38. The CNA is assisting to turn a client who has a Foley catheter. Where should the Foley catheter be anchored to prevent pulling on the catheter? A. Bed rail. B. Upper thigh. C. Lower thigh. D. Lateral aspect of knee. The correct answer is B. Upper thigh. Securing the Foley catheter to the upper thigh can decrease pulling on the catheter. The bed rail should not be used. The lower thigh and knee are too low on the body to provide the needed support. Question 39. A client has a confirmed case of influenza. The CNA would anticipate using which infection control precautions when caring for this client? A. Contact precautions. B. Respiratory precautions. C. Reverse precautions. D. Bloodborne exposure precautions. The correct answer is B. Respiratory precautions. Influenza is a transmissible respiratory illness. Respiratory precautions should be utilized in addition to universal precautions to reduce transmission of this illness for clients who have confirmed cases of influenza. Question 40. The patient that is bedbound is at risk for which of the following? A. Dysphagia. B. Polydipsia. C. Atrophy. D. Impaction. The correct answer is C. Atrophy. Muscle atrophy is very real for patients who are bedbound. Atrophy is muscle wasting and it happens rather quickly. Passive and active range of motion should be done with the patient to keep the patient from experiencing atrophy. Question 41. You have a patient that only likes to shower once weekly. It is important for you to realize what? A. Your facility has a shower schedule and the patient needs to be educated on her allotted shower time. B. Cultural differences in bath taking is often overlooked by healthcare professionals. C. The patient's family needs to be aware of the patient's refusal to bathe. D. The patient is at high risk for depression if she does not shower more often than once weekly. The correct answer is B. Cultural differences in bath taking is often overlooked by healthcare professionals. As healthcare workers, we often forget that there are cultural differences in things such as bathing. Healthcare professionals see lots of dirty things, so our minds can think dirty a lot. However, it is important to remember that there are cultural differences in such things as bathing, and the patient may not feel as though she is dirty. Her culture may not allow her to bathe, but once weekly. It is important to speak to the patient and build a rapport with her to figure out her reasoning behind her bathing beliefs. This way, she does not feel as though you are trying to force her into anything. Question 42. You have a patient in soft wrist restraints. You must check the wrist restraints per the doctor's orders to ensure the patient's safety. Failure to do this can result in charges for A. Neglect, B. Aiding and abetting, C. False documentation, D. Incidental harm. The correct answer is A. Neglect. The legal definition for neglect is mistreatment. Neglect is a result of carelessness and failure to care for a patient properly. The first priority is always patient safety. Question 43. Why is it essential to close the door and the curtain when performing postmortem care? A. You do not need to close the curtain. B. It is important to close the door and curtain so no one sees the resident. C. You only need to close the curtain. The door can stay wide open. D. Even though the patient is deceased, we need to be respectful and provide privacy. The correct answer is D. Even though the patient is deceased, we need to be respectful and provide privacy. Remember, just because a resident is deceased, they still need to be treated with respect. Closing the door and curtain provides privacy. We are still obligated to ensure we are being respectful to the resident by initiating proper protocol when caring for them after death, and providing privacy is one way of being respectful. Not only are we being mindful of the patient, however, the family as well. Question 44. You have a 70-year-old patient that is usually pleasant and easygoing. Today, she has cognitive delays, is hitting and kicking, and does not know who the staff are. Which condition is the patient likely experiencing? A. Urinary tract infection. B. Headache. C. Sinus infection. D. Hunger. The correct answer is A. Urinary tract infection. It is common for patients 65 years of age and older adults to have a UTI. A UTI in the older adult population can cause significant acute cognitive impairments. The CNA should report this to the nurse in charge. Question 45. If a resident reports that a family member hurt them during a visit and insists it be kept a secret, the CNA should A. Assure the resident that no one can hurt them. B. Call the police. C. Notify the nurse or supervisor. D. Advise a different family member about the resident's report. The correct answer is C. Notify the nurse or supervisor. Residents have the right of freedom from abuse, neglect, or mistreatment. The CNA is required to report suspected abuse. The situation should be investigated if it appears a resident's rights are not being honored. Question 46. The CNA is assisting a female with toileting. Which of the following describes correct technique? A. Wipe the perineal area front to back. B. Wipe the perineal area only after bowel movements. C. Do not wear gloves to promote patient dignity. D. Leave the curtain or door open to the bathroom area. The correct answer is A. Wipe the perineal area front to back. Cleansing of the female perineal area should be done by wiping from front to back. This prevents bacteria from the rectum being transferred to the vagina. Question 47. You have a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would you question if it arrived on the patient's tray? A. Regular orange juice. B. Mashed potatoes. C. Jell-O. D. Applesauce. The correct answer is A. Regular orange juice. Typically, when a patient is on strict dysphagia precautions, they will require thickened liquids. The orange juice should be thickened with a thickener in order for the patient to consume it. The CNA/nurse should look at the MD orders to determine which consistency the orange juice is to be thickened to, i.e., honey or nectar. Question 48. The patient is lying in the supine position. In what position is the patient's bed? A. 90 degrees. B. Flat. C. Tilted upside down at 30 degrees. D. 45 degrees. The correct answer is B. Flat. The patient assumes the supine position when the bed is lying flat. This position may be assumed for turning and providing personal care to the patient. Question 49. You have a patient with generalized weakness to transfer from the bed to the chair. Which transfer device would you use? A. A Hoyer lift. B. A sit-to-stand lift. C. A sliding board. D. A gait belt. The correct answer is D. A gait belt. A gait belt is used to transfer a patient from one place to another, such as a bed to chair, chair to bed, or bed to wheelchair. It is used to assist patients who are weak, not bedbound, in transferring. Question 50. You see your diabetic patient is sweating, disoriented, and unable to speak. What is the first thing you would assess? A. Temperature. B. Pupils. C. Pulse. D. Glucose. The correct answer is D. Glucose. When a diabetic patient is sweating, unresponsive, or disoriented, it is important to perform a point-of-care glucose. These are signs of hypoglycemia. Hypoglycemia causes cognitive issues and should be treated promptly to avoid a diabetic coma. Question 51. Which of the following is the best way to prevent the spreading of germs? A. Wearing gloves during patient care. B. Wearing a mask and gloves with patient care. C. Hand washing before and after patient care. D. Wearing a gown, mask, and gloves while performing patient care. The correct answer is C. Hand washing before and after patient care. Hand washing is the #1 way to keep from spreading germs in the healthcare setting. One should rub their hands together with soap for a minimum of 20 seconds during hand washing. Hand hygiene should always be performed before and after patient care. Question 52. The CNA is caring for a patient with an infection of Clostridium difficile. Which of the following would the CNA anticipate utilizing in caring for this client? A. Surgical mask. B. N95 respirator. C. Face shield. D. Gown. The correct answer is D. Gown. Clostridium difficile is a gastrointestinal infection. Infection control to decrease spread of this condition includes contact precautions for which a gown would be worn. Question 53. What is one physical change you may notice when death is approaching? A. There will be no physical changes. B. More energy. C. Loss of appetite. D. Increased activity. The correct answer is C. Loss of appetite. One common physical change you may notice is loss of appetite. You will notice your resident eating and drinking, or not at all, as death nears. If the resident is alert and oriented, you can always offer small sips of fluids or small bits if they are able to eat. Question 54. The Certified Nursing Assistant, CNA, is aware that attention-seeking behaviors in the nursing home resident may include all of the following, except A. Going to every social event in the nursing home. B. Refusing to visit with their family. C. Excessive use of the call light. D. Refusing to go to therapy. The correct answer is A. Going to every social event in the nursing home. It is healthy for residents to participate in all social events. Excessive use of the call light is attention-seeking behavior, as well as lying down on the floor and then calling out for help or asking for pain medication and then refusing it. Not eating all their meals, refusal of family visits, or refusal to attend therapy are not common attention-seeking behaviors. Question 55. When should universal precautions be practiced? A. For all client encounters. B. When the client has an open wound. C. When the client has a fever. D. When the client has a cough. The correct answer is A. For all client encounters. Universal precautions should be utilized for all client encounters to promote safety of clients and staff. Question 56. A resident's room is sloppy and the resident won't tidy up. The CNA should A. Clean the room while the resident is at an appointment. B. Insist the resident put all the things away or they will be thrown away. C. Let the resident know that some of the things are a safety hazard and help them relocate the items. D. Notify the resident's power of attorney. The correct answer is C. Let the resident know that some of the things are a safety hazard and help them relocate the items. Residents have the right to keep and use personal belongings. If belongings are moved without the resident's knowledge, it can cause distress and mistrust. Staff do not have the authority to discard residents' belongings. Question 57. You have a patient that does not drink adequate fluids. The patient is at risk for all of the following except A. Mouth sores, B. Bath breath, C. Skin ulcers, D. Swollen gums. The correct answer is D. Swollen gums. A patient who does not drink adequate fluids is at high risk for dehydration. Patients with dehydration are at risk for mouth sores, bad breath, skin breakdown, and tooth decay. Question 58. It is estimated that delirium is noted in at least 40% of nursing home residents in the United States. The Certified Nursing Assistant, CNA, is aware the resident with delirium might suffer from what symptom? A. Resident becomes tearful and upset at small changes in schedule. B. Resident see or hears things that other residents and staff do not. C. Resident becomes weaker and experiences episodes of incontinence. D. Resident loses the ability to speak. The correct answer is B. Resident see or hears things that other residents and staff do not. Residents suffering from delirium may see or hear things that others do not or fail to recognize those around them. They do not lose the ability to speak or become any weaker because of the delirium. Question 59. A sometimes confused resident reports that something was taken from the room. The CNA should A. Remind the resident that the item is not valuable. B. Help the resident look for it. C. Call the police. D. Call the resident's power of attorney. The correct answer is B. Help the resident look for it. Residents have the right to keep and use belongings. Memory can be impaired, and the possibility of the item was misplaced needs to be explored. If it is not found, it should be reported to a supervisor. Question 60. You have a patient that has pneumonia and is weak. What teaching would you provide to the patient? A. Make sure to cough and deep breathe often throughout the day. B. Be sure to keep your liquid intake to 600 cubic centimeters per day. C. Be sure to exercise your arms by doing range of motion multiple times a day. D. Be sure to try to be still so that your chest is not in pain. The correct answer is A. Make sure to cough and deep breathe often throughout the day. It is important for patients with pneumonia to cough and breathe deeply often to keep the pneumonia from worsening. It is important to encourage fluids to help thin any fluid in the lungs. It is also important to encourage the patient to get up and walk and move as much as possible to keep the fluid in the lungs moving.
Thank you for watching this video, and we hope it was helpful. Click the link right here to start your free 3-day trial to CNA Premium, which has over 1,000 practice questions that will help you pass your CNA exam on your first try.